Stop what you are doing for just a moment, because the information I'm about to share could protect your health or even save the life of someone close to you. There is a dangerous virus quietly spreading in parts of the United States and other regions of the world right now, and most people have never even heard of it until it becomes a medical emergency. Hospitals are seeing severe cases appear suddenly, especially in older adults, and many victims mistake the early symptoms for something minor until their condition rapidly becomes life-threatening. The virus is called Hantavirus, and in today's video, I'm going to explain exactly how this virus spreads, why adults over 60 are at much higher risk of serious complications, what warning signs should never be ignored, and the simple precautions every family should start taking immediately. If you're new here, I'm Dr. Mandell. Over the years, I've spent decades studying how infections and chronic diseases affect the aging body differently, especially in adults whose immune systems become more vulnerable with age. And what makes this virus especially frightening is how quickly it can overwhelm the lungs once symptoms begin. According to reports from the Centers for Disease Control and Prevention, the severe form known as Hantavirus pulmonary syndrome has an alarming fatality rate that can approach nearly 40% in some cases. That means this is not something older adults should casually dismiss as just another virus. And here's the part many people still don't realize. After the age of 60, immune defense mechanisms naturally weaken, inflammation increases, and the body becomes less efficient at fighting sudden infections. That combination can make older adults significantly more vulnerable to severe complications if exposure happens. Before we go further, I want to hear from you. Tell me your age in the comments below and let me know if you've recently been around garages, sheds, storage areas, cabins, gardens, barns, or any place where rodents may have been present. Most people hear the word hantavirus and either have never encountered it before or they assume it only affects people who live in remote wilderness areas or work in agriculture. That assumption is one of the most dangerous misconceptions I see because hantavirus does not care where you live. It only cares about one thing, whether you came into contact with an infected rodent or the traces it left behind. Here is what is actually happening inside the body when exposure occurs. When a person inhales tiny airborne particles of infected rodent urine, droppings, or nesting material, the virus enters the respiratory tract and begins attaching to the cells lining the blood vessels. These are called endothelial cells, and they are responsible for keeping your blood vessels tight and controlled. Once hantavirus begins attacking these cells, the vessels start leaking fluid. In the lungs, this becomes catastrophic. Fluid accumulates in the air sacs, the places where oxygen exchange happens, and the lungs begin to drown from the inside. This condition is called Hantavirus pulmonary syndrome, and it carries a mortality rate that can reach 40% even with modern intensive care. In older adults whose cardiovascular and pulmonary systems are already under the natural strain of aging, that risk climbs even higher. What most seniors never realize is that this process begins silently, often looking exactly like a mild flu for the first several days. And that is precisely where the danger hides. But understanding the first stage of infection is only part of the problem. The first and most critical mistake people make is dismissing the early symptoms as something ordinary. Fatigue, muscle aches, a low-grade fever, maybe a headache. These are the exact complaints that older adults experience with dozens of common and harmless conditions, which is exactly why hantavirus so often goes unrecognized until it is far too late. What you need to understand is that these early symptoms are not random. They are the immune system recognizing an invader and launching its initial response. Cytokines, the chemical messengers your immune system releases to fight infection, are flooding the body. Inflammation is rising. And underneath that surface reaction, the virus is already beginning to compromise the blood vessel lining in ways that will become critical within days. The practical action here is this. If you or someone you care for develops fever, deep muscle aches, and fatigue within 1 to 5 weeks of any activity that involved potential rodent exposure, do not wait. Do not assume it is the flu. Do not assume it is aging. Go to a physician and specifically mention the possibility of rodent contact. That single sentence spoken early enough can be the difference between treatment and tragedy. A 2021 review published in the journal Viruses confirmed that clinical outcome in hantavirus cases is directly correlated to how quickly supportive care begins. Every hour matters once the pulmonary phase begins. But what comes next in the progression is something most people are completely unprepared for. The second major danger with hantavirus is the deceptive gap between the early phase and the life-threatening phase. Medical professionals call this the prodromal period, and it typically lasts between 3 and 7 days. During this window, the patient often feels like they are simply dealing with a bad flu. They may even feel slightly better for a brief period. And this false improvement is one of the most dangerous moments in the entire disease course. Because what is happening beneath the surface during this period is a silent escalation. The virus is continuing to damage endothelial cells throughout the vascular system. Capillary permeability is increasing, meaning the walls of the smallest blood vessels are becoming leaky. The immune system is mounting an increasingly aggressive response, and in older adults, that inflammatory response can itself become harmful, pushing the body toward a dangerous overreaction. Researchers at the University of New Mexico, a leading center for hantavirus research, have documented that the transition from prodromal phase to cardiopulmonary phase can occur within hours, not days. One morning a patient appears stable. By afternoon they are in respiratory failure. For adults over 60, this rapid deterioration is especially dangerous because pre-existing conditions like hypertension, reduced lung capacity, or mild cardiac impairment leave almost no buffer when the lungs begin to fill. The moment oxygen levels begin to drop, the cascading effects move faster than most people expect. And the next layer of this danger involves something that almost no one talks about. When the cardiopulmonary phase of hantavirus begins, the consequences are no longer contained to one system in the body. The fluid that is leaking from damaged blood vessels does not only accumulate in the lungs, it creates a systemic crisis. Blood pressure drops. The heart begins working under extreme stress, attempting to maintain circulation while volume is being lost into surrounding tissues. Oxygen delivery to vital organs starts to fail. In older adults, this multi-organ stress hits systems that are already operating with reduced reserve capacity. The kidneys, which are responsible for filtering toxins and maintaining fluid balance, come under intense strain. A 2020 study published in the American Journal of Respiratory and Critical Care Medicine found that patients who developed acute kidney involvement alongside hantavirus pulmonary syndrome had significantly worse outcomes than those without kidney complications. The heart faces its own crisis. Hantavirus is known to cause what is called myocardial depression, a measurable reduction in the heart's pumping efficiency. In someone over 70 whose cardiac output is already naturally reduced compared to a younger adult, this added suppression can be the tipping point between surviving and not surviving. This is not meant to create panic. It is meant to make something absolutely clear. Hantavirus is not just a lung disease. It is a full vascular and multi-organ disease that unfolds rapidly, and the body systems most vulnerable to it are exactly the systems that aging has already been quietly stressing for years. What comes next in this conversation is something I want every viewer to pay very close attention to. Before I continue, I want to ask you something directly. Have you ever cleaned out a garage, a basement, a garden shed, an attic, or an old cabin and noticed rodent droppings or signs that mice had been living there? If the answer is yes, I want you to type the word yes in the comments right now. Because what I am about to share is something that applies to millions of people who never connect those ordinary cleaning moments to a serious biological risk. Most people assume that if they did not get sick immediately after that kind of exposure, they are in the clear. But hantavirus has an incubation period that ranges from 1 week to as long as 8 weeks, though most cases develop within 2 to 4 weeks of exposure. That means a cleaning job you did last month could still be silently relevant right now. The CDC has documented cases of hantavirus in more than 34 states across the United States, with the highest concentrations in the Southwest, but with confirmed cases appearing in every region. The deer mouse is the primary reservoir, but several other rodent species carry their own hantavirus variants, and rodents do not announce themselves. They find their way into homes, sheds, and storage spaces quietly, leave microscopic traces, and disappear before anyone notices they were ever there. This is the hidden exposure risk that most seniors never connect to the symptoms they feel weeks later. And what I need to explain next will show you exactly how exposure happens even when you never see a single mouse. Here is where the stakes become even more serious and where most people are operating with completely wrong assumptions about how transmission actually occurs. You do not need to touch a rodent to contract hantavirus. You do not need to be bitten. You only need to breathe in particles that an infected rodent left behind, and in enclosed spaces that risk is far higher than most people ever consider. When a mouse or rat urinates or defecates in a confined area, those materials dry over time. When disturbed, whether by sweeping, moving boxes, shaking old fabric, or even walking through a dusty space, microscopic particles become airborne. A single breath in that moment can be enough. And here is what makes this especially dangerous for older adults specifically. Research published in the Lancet Infectious Diseases Journal has highlighted that immunosenescence, the natural decline in immune function that comes with aging, reduces the body's ability to mount a rapid and targeted initial response to novel viral threats. This means the window between exposure and serious illness may be shorter in older adults than in younger ones. The immune system that should be catching the virus early is slower to respond, and by the time a strong defense is mounted, the virus has already gained ground. For adults who live alone, this risk carries an additional dimension. Deterioration can progress for days without anyone noticing warning signs that might prompt an earlier call to a doctor. By the time symptoms become impossible to ignore, the cardiopulmonary phase may already be approaching. And this leads directly to something that most medical sources underemphasize entirely. One of the most overlooked and misunderstood aspects of hantavirus in older adults is how closely its early symptoms mimic the conditions that seniors are already managing every day. This is the diagnostic trap that delays treatment, sometimes fatally. An older adult with chronic fatigue, joint aches, or a history of respiratory issues may not register a slight worsening as alarming. A person managing heart disease or COPD may attribute new breathlessness to their existing condition rather than to something new and rapidly escalating. A senior living with diabetes may have a blunted fever response due to immune dysregulation, meaning one of the most recognizable early warning signs, elevated temperature, may not even appear clearly. This is exactly why I tell every patient context matters as much as symptoms. If you feel worse than your baseline and you have had any potential rodent exposure in the past 4 to 6 weeks, that combination of context plus symptoms must be communicated to a physician immediately and explicitly. Do not wait for the symptoms to become undeniable. By then, you may be waiting in an emergency room rather than a clinic. A simple blood test in the early phase can show thrombocytopenia, a drop in platelet count, which is one of the earliest measurable markers of hantavirus infection. Catching that marker early gives medical providers the lead time they need to prepare supportive care before the pulmonary phase begins. This brings us to the most important section of everything I have shared today. Here's what you can do right now to reduce your risk and protect yourself and the people you love. First, if you plan to clean any enclosed space where rodents may have been present, including a shed, basement, attic, crawl space, cabin, or storage unit, do not sweep or vacuum first. Sweeping and vacuuming aerosolize particles and dramatically increase your inhalation risk. Instead, ventilate the space by opening doors and windows for at least 30 minutes before entering. Wear an N95 respirator, not a simple dust mask. Wear gloves. Dampen any visible droppings with a bleach solution, 1 part bleach to 10 parts water, and wipe them up rather than sweeping them. Second, seal any entry points into your home where rodents could gain access. Mice can enter through gaps as small as a 1/4 inch. Check around pipes, utility lines, foundation gaps, and door seals. Steel wool and caulk are effective materials for blocking these entry points permanently. Third, store food, pet food, and bird seed in sealed hard containers. Rodents are drawn to accessible food sources. Removing that access removes the incentive for them to enter and establish nesting areas near your living space. Fourth, and this is critical, if you develop fever, deep muscle aches, fatigue, or any respiratory symptoms within 1 to 5 weeks of a potential exposure event, go to a physician that same day. Tell them specifically about the exposure. Ask them to consider hantavirus in the differential. A 2019 analysis in emerging infectious diseases found that physician awareness of exposure history was the single most reliable factor in early hantavirus identification. Your voice in that appointment is a clinical tool. I want to leave you with something important. Hantavirus is rare, but rare does not mean impossible, and it certainly does not mean you should be unprepared. The seniors I have seen struggle most with serious illness are almost always the ones who dismissed early signals, who waited, who assumed the worst could not happen to them. The ones who recover, who walk out of hospitals and go back to their lives, are almost always the ones who acted early, who paid attention, who took one extra step when something felt wrong. You now understand something that most people, including many primary care patients, do not. You know how this virus enters the body. You know what the early warning signs look like and why they are so easy to dismiss. You know which existing health conditions in older adults make the disease more dangerous. You know how to reduce your exposure risk, and you know exactly what to say to a doctor if exposure is possible. That knowledge is not small. That knowledge could be the exact thing that makes the difference in a moment that counts. If you found this information valuable, please share this video with someone you care about. A family member, a neighbor, a friend who likes to work outdoors or clean old spaces. You never know whose life that share might quietly protect. And if you want to keep receiving medically grounded information designed specifically to protect adults over 60, make sure you subscribe to this channel. I am Dr. Alan Mandell, and I will keep bringing you the health awareness that your doctor sometimes does not have time to deliver. Take care of yourself. You deserve to live well, and you deserve to know what your body is trying to tell you.